Hi, my name is Angie. If you don't know what I do, I help people who are deprescribing psychiatric drugs. That sounds crazy. I know that. Why would someone want to do that? Well, there's lots of reasons why people don't want to take psychiatric drugs for life. Above all, I think it's a human rights issue that we should be allowed to do that and do that safely. And I will tell you, in coaching thousands of people over the last few years full time, there's lots of barriers to be able to do that. One of the barriers is doctors don't believe patients should have the right to come off. I don't know where that comes from. There's a lot of multiple messages behind that, like your depression will come back, your PTSD will get worse, your anxiety will get worse. I don't think it gives enough credit to the individual who wants to do something like that and the desire to find other ways to heal besides medication. Another barrier to coming off psychiatric drugs is finding dosages that are small enough to taper safely and slowly. We saw this example highlighted a couple months back when the Addiction Medicine Society people, ASAM, put out benzodiazepine tapers. Those are drugs for anti-anxiety like lorazepam, Valium, Xanax, Klonopin. And they suggested people taper 5 to 10%. But they didn't suggest how a person would do that. So doctors are exceedingly hesitant to prescribe liquids to people or to teach them how to taper at small doses like 5 to 10%. People in our community, we know how to do that. I tapered Cymbalta over 2.5 years, taking the little tiny balls out and counting them. It was a pain in my butt. Then I dry cut lorazepam after that, which was using a tablet cutter, which is not actually accurate because active ingredient is spread out throughout the tablet. It's not evenly distributed all the time. So that's the second barrier. Third barrier is patients that want to come off psychiatric drugs cannot find meaningful services. For instance, someone like me who's trained as a therapist, who decided not to be a therapist, who decided not to be licensed because I disagree with the system so much, that is here to support you and show you the way and coach you along the way with strategies and coping to get through it and to get your life back and your mind back. That is a huge thing. Also, patients that are tapered too quickly, put in detox, put in rehab places that are not appropriate, that can cause more harm. And lastly, I could do this for an hour talking about all the barriers to successful deprescribing, but lastly, patients are not believed that their symptoms are as severe as they are. It is very serious, in some cases life-threatening, when doctors don't understand, or therapists or coaches don't understand how severe someone's symptoms can be and don't know the way to guide them to deal with those without thinking it's their mental illness or they're doomed and it's permanent and they're never going to get better. So if you are someone who is interested in deprescribing psychiatric drugs, please, I beg you to find online communities that are safe and loving and more on the positive side and healing focused rather than scary to help you mitigate this process, because meaningful mental health services do not exist except in our community right now. And there's several of us in the background building things. I'm going to build something new. I just sent the email off, which has just got me pumped up. I'm hiring a bunch of people to help me because this is a growing situation. Mark my words, it's worse than the opiate crisis. I don't know when the story is going to break or what's going to take to break it because I've been working on that for several years. But anyway, we are here. Some of us have done it. Some of us have learned very, very hard ways. For instance, me, my story is in the film Medicating Normal free on YouTube. But hang in there. We got you until the cavalry comes, and maybe they don't come, and maybe we don't want them to come. I don't know. But hang in there. Find us. Thanks.